Dr. Lines, what made you decide to expand up to Rexburg?
Well, we already have so many wonderful patients that are coming down from Rexburg to Idaho Falls. We just really wanted to be able to bring that good care that they need here in Rexburg and be able to help others in Rexburg as well.
Where is Mountain Peak Pediatrics located in Rexburg?
We're located on North 2nd East, about a block south of Walmart.
So Mountain Peak Pediatrics, are you guys not Idaho Falls Pediatrics?
So same group, same doctors. We just wanted to give a name that reflects Rexburg and not specifically Idaho Falls. That is something that someday we may be rebranding, but it's same company, just under a different name.
What age range of children do you care for?
We take care of the littlest, those kids right out of the nursery, even those preemies right out of the NICU, all the way through 18 years old.
Why should I take my kids to a pediatrician?
That's a great question. Pediatricians get training focused specifically on people that are aged infants, children, all the way through adolescence, which helps us be able to focus on age-related diseases, be able to see delays in development and growth, and then also be able to see pediatric specific presentations, things that differ from adults. And on that note, it's always great to be able to see the pediatrician regularly, even when we don't have any specific concerns, because then we're able to see things early on. It's always easy to catch things early on or prevent them as opposed to treating them, which is still an option. It's just easier to catch them early on.
Do I need to schedule an appointment or do you guys have urgent care hours?
Always best to give us a call beforehand because sometimes we get busy, but we do always reserve appointment slots every day for people that are sick that day. When you didn't know a couple weeks in advance that you're going to be sick that day, we save some spots to be able to treat those kids as well.
So if my kid is sick with some kind of virus, because there's a lot going around right now, what kind of signs should I look for? How do I treat them?
That's a really good question, just because viruses are so common and they're so easy to give to one another. So the best thing to do is really understand what a virus looks like. So you have a lot of different symptoms, and every virus presents a little bit different in every person, but you'll have a fever, you can have a cough, you can have a runny nose. If it's more of a stomach virus, you can have some nausea, some vomiting, maybe even some diarrhea. The best thing to do in all those is recognize how they look though. And viruses typically last anywhere from 5 to 10 days, and they get worse till about that middle part, and then they start getting a little bit better every day. So just make sure the child is comfortable. Lots of hydration. That's going to be your best friend. Lots of hydration. Even if they're not eating and drinking super well, make sure they're staying hydrated and peeing at least a couple times every day. Then when it starts to vary from those symptoms, everyone knows what the virus looks like. If they're getting better or they start getting better and then they take a turn for the worse, that's when you should call a pediatrician. Or when it just feels like it's just going on too long, you're at that week mark and you're not seeing any improvements, give the pediatrician a call. That's a great time to get them in to be seen.